Welcome to the Greenbridge Minute, brought to you by Greenbridge Health and Greenbridge Society. My name is Dr. Gerald Knapp. I have helped many patients use cannabis to alleviate their chronic pain. Unfortunately, medical cannabis is often used as a treatment of last resort. Considering its safety profile and effectiveness, medical cannabis should be considered as a first-line therapy for many patients. Chronic pain is a prevalent and multifaceted condition affecting over 50 million adults in the United States alone. Current pharmacological treatments such as opioids and NSAIDs have fallen short of relieving pain for many patients. And these classes of medications have serious and dangerous side effects. On the other hand, if used under the guidance of a medical professional and titrated appropriately, medical cannabis poses very little risk at all. Using cannabis for pain can be traced back to ancient Chinese writings dating to 2900 BCE. And there is evidence that cannabis was used to treat pain in ancient Egypt, Greece, and India. Cannabis was rediscovered by Western medicine in the 19th century, and by the end of that century, it could be found in every pharmacy in the United States in a variety of preparations commonly used to treat pain. In more recent years, research into cannabis has demonstrated its effectiveness for treating chronic pain. The University of Toronto did a systemic review of randomized controlled trials examining cannabinoids in the treatment of chronic pain. They concluded that 15 of 18 trials demonstrated significant analgesic effect with no serious adverse effects. In 2017, the National Academies of Sciences, Engineering, and Medicine published a review of 29 randomized trials and concluded that cannabis is an effective treatment for chronic pain among adults. Let's look closer at the chemical composition of cannabis and how these components can help treat chronic pain. Cannabis contains chemicals called cannabinoids that interact with the human body's natural endocannabinoid system. The endocannabinoid system actively modulates pain signaling throughout the central and peripheral nervous systems. In many ways, phytocannabinoids, which are the cannabinoids from the cannabis plant, mimic the natural effects of our own endocannabinoids. THC, or tetrahydrocannabinol, is one of the two major cannabinoids found in cannabis. THC has been shown to relieve central and neuropathic pain. THC can modulate pain at the level of the spinal cord and brain by directly activating CB1 receptors and indirectly by increasing opioid receptor activation. Like several other chemical components in cannabis, THC has anti-inflammatory properties that can contribute to pain reduction too. Cannabidiol, or CBD, is the other major cannabinoid. CBD has shown to provide analgesic effects for neuropathic and inflammatory pain. CBD impacts pain by increasing levels of the endogenous cannabinoid, anandamide, and by reducing inflammation. CBD seems to target other receptors beyond the endocannabinoid system that may reduce pain as well. For pain relief, using the combination of THC and CBD is more effective than using either cannabinoid alone. Much of the scientific research studying this combination surrounds the European prescription drug Sativex. Sativex is an oral mucosal spray intended to be sprayed under the tongue or inside the cheek. Sativex is a 1-to-1 product, meaning that it contains 1 part THC and 1 part CBD. Dispensaries in the United States commonly carry similar 1-to-1 tinctures. In a randomized controlled trial looking at cannabis extracts, a THC-only product, a THC-CBD combination product, and a placebo were all compared in patients with intractable pain despite opioid treatment. The product containing both THC and CBD proved significantly better than both THC alone and placebo. This study shows that the combination of THC and CBD can help relieve pain in patients with advanced cancer pain not fully relieved by strong opioids. A follow-up study with these patients concluded that the long-term use of the THC and CBD combination was generally well tolerated, with no loss of effect for the relief of cancer-related pain. Furthermore, patients who kept using the medication did not seek to increase their dose of the cannabis or other pain-relieving medications over time. These are both significant advantages of cannabis compared to using opioid medications alone. Many of the chronic pain patients we have seen have responded very well to cannabis products containing both THC and CBD. An additional benefit of this combination is that CBD reduces some of the possible side effects associated with THC. In addition to THC and CBD, over 130 minor cannabinoids have been identified, and several have shown promise in alleviating chronic pain symptoms. For example, preclinical studies have demonstrated analgesic benefits from CBN, CBG, and CBC. More research is needed in this area. Another class of chemicals found in cannabis are the terpenes. Terpenes are like the essential oils of cannabis, and they contribute to the flavor and aroma of cannabis. And some terpenes do provide some analgesic effects. In animal studies, beta-caryophyllene, a terpene that has a pepper-like flavor, was shown to decrease inflammatory and neuropathic pain. Other terpenes, such as myrcene, linalool, pinene, and limonene, may also contribute to the ability of cannabis to reduce pain. At Greenbridge Health, we work with patients to find the best cannabinoid and terpene composition for them. We also help patients evaluate the products available to them at their local dispensaries. Medical cannabis comes in several types of dosage forms. Most chronic pain patients respond well to longer-acting dosage forms of cannabis, such as tinctures and capsules. And we have seen that these dosage forms provide the best reduction in pain over time. It is always recommended to start at a low dose and increase slowly. Patients are instructed how to safely titrate their dose to find the sweet spot. This is where their symptoms are relieved, but they are not experiencing unwanted side effects or feeling over-medicated. For breakthrough pain, our patients tend to use products that can be vaporized due to the faster onset of action. These inhaled products can be used in conjunction with the longer-acting products to give patients more control over treating their level of pain each day. Topically applied cannabis products such as creams and lotions can also provide site-specific pain relief. We have seen these products work particularly well in joint pain and muscle spasms. With a proper cannabis regimen, we have seen many patients significantly reduce or discontinue their opioid medications. Since cannabis and opioids can be used safely together, we often help patients dial in their cannabis treatment before the patients discontinue their opioid medications. Over time, as a patient's pain is controlled by medical cannabis, the patient is encouraged to work with their pain management physician to slowly reduce their opioid medications. There are so many different types of chronic pain, and every patient has their own unique set of symptoms. At Greenbridge Health, we help each patient find the best cannabis regimen for them. If you would like to schedule a medical cannabis consultation, please go to our website, greenbridgehealth.com, and make an appointment to meet with one of our experienced medical professionals. We look forward to helping guide you on your cannabis journey back to health.